Hey everyone, my name is Kristen Kilcollins, and my presentation is on Aroostook Mental Health Center, or AMHC for short. They're based out of Caribou, Maine, and they were established in 1964. AMHC is a community-oriented, nonprofit behavioral health center that offers crisis, outpatient, rehab services, residential care, peer support, and educational services to meet the community's mental health, substance use, and brain injury treatment and recovery needs since 1964. They provide these services to Aroostook County, Hancock County, and Washington County, all located in Maine. AMHC's mission is to provide integrated healthcare services that maximize an individual's potential to recover and improve their quality of life. Their mission and values fall under both policy development as well as assurance. Policy development by educating, informing, and empowering the community, while also mobilizing community partnerships by providing consultations with other facilities and giving back to the community, by volunteering with other groups to help spread awareness of behavioral and social problems while also advocating for their other programs. They also fall under assurance by providing a link to access to medical care to help promote a healthy community, while also maintaining highly trained, licensed professionals who are competent in their respective fields. AMHC provides resources for underserved communities in Maine by aiding in the well-being of individuals through counseling, rehab, and other outpatient services. Some of the services that they offer are counseling and case management, emergency and crisis services, residential treatment, group homes and apartments, therapeutic foster care, supportive visitation services, and sexual assault victim advocacy and education programs. They help provide education to the community about substance abuse, brain injury treatment and rehab, mental health, and crisis assistance. Some of the other education that they provide is on forms of addiction, whether it's sexual addiction, gambling, or alcoholism. They also have education on anger management, child and adolescent development, as well as counseling and help for new parents. They also provide consultation to hospitals, churches, law enforcement, nursing homes, businesses, and other facilities on social and behavioral health issues. Having worked and lived in a small community with limited resources for my entire life, it is good to know that we have a community-oriented group that is there to help those who are in need. Having been in the healthcare field for 8 years now has made me very aware of the limited resources available for crisis intervention and the need for more facilities like this one. Not only do they provide consultation to hospitals and other facilities, but they also participate in suicide prevention walks as well as other community-oriented events to raise awareness of behavioral, mental health, and substance abuse problems within our communities. AMHC can be contacted 24/7 for emergency crisis interventions, as well as for regular appointments on weekdays. They can be reached by phone at 207-498-6431, on their website at www.amhc.org, or by mail at 43 Hatch Drive, Box 1018, Caribou, Maine 04736. Thank you everyone for your time and consideration of this group, and I hope you enjoyed this presentation. Thank you again.